Assalamu alaikum. Dear viewers, I am Dr. Atiqur Rahman, Assistant Professor, Anatomy Department, Akij Medical College, Khulna. Today, I will discuss about classification of connective tissue. Connective tissue is a basic type of tissue which is structurally formed by cells, fibers, and ground substance. Connective tissue binds, anchors, and supports various cells, tissues, and organs in our body. Now, classification of connective tissue. Connective tissue are mainly two types: embryonic and adult. Embryonic connective tissue is classified into two subtypes. Number 1, mesenchyme, and number 2, mucus. Mesenchyme is primarily found in the embryo and developing fetus. The mesenchyme originates from the mesodermal layer of early embryo. Mucous connective tissue is distributed in Wharton's jelly of the umbilical cord, pulp of the developing teeth, vitreous body of the eyeball. Now, adult connective tissue. Adult connective tissue are divided into two general subtypes. Number 1, connective tissue proper or general connective tissue, and number 2, specialized connective tissue. General connective tissue are two types: loose connective tissue and dense connective tissue. Loose connective tissue or areolar tissue is distributed in lamina propria beneath epithelial lining, space between groups of muscle cells, a layer that ensheathes the lymphatic and blood vessels, papillary layer of the dermis, hypodermis of the skin, serosal lining of the peritoneal and pleural cavities. Now, dense connective tissue. Dense connective tissue can be further subcategorized into two basic types based on the organization of its collagen fibers. Number 1, dense irregular connective tissue, and number 2, dense regular connective tissue. Dense irregular connective tissue present in dermis of the skin, sheaths of the nerve, fibrous capsule of the spleen, testes, ovary, kidney, lymph nodes, submucosal layer of the gastrointestinal tract, fibrous sheath of bone and cartilage. Dense regular connective tissue is divided into collagenous and elastic types. Collagenous connective tissue present in tendons, ligaments, aponeurosis. Elastic connective tissue present in ligamentum nuchae, ligamentum flava. Now, I will discuss about the classification of specialized connective tissue. Specialized connective tissues are reticular connective tissue, adipose tissue, bone, cartilage, blood. Reticular connective tissue are two types. Number 1, hemopoietic, and number 2, lymphatic. Hemopoietic types present in bone marrow, and lymphatic types present in spleen, lymph nodes. Adipose tissue. There are two types of adipose tissue. Number 1, unilocular or white adipose tissue, and number 2, multilocular or brown adipose tissue. White adipose tissue present in subcutaneous fat, intra-abdominal fat, fat in the axilla. Brown adipose tissue present around the kidneys, aorta, adrenal glands, in the back, neck, shoulder. This is all for today. Hope you will get some idea about classifications of connective tissue. Thank you.